Welcome back to the Dawn Show. So the question is, should the government actually overrule your own doctor when it comes to your health? And we're talking about breast health with Dr. Beth, Dr. Catherine. It's so good to have you here. And this is something that makes you infuriated.
It doesn't really infuriate me. It concerns me because...
Oh, come on.
I trained for a lot of years to specialize in diseases of the breast. And when insurance companies are now going to follow guidelines that were created by physicians who don't actually treat breast cancer or diagnose breast cancer, that's where the concern comes in, because there's lots of different ways that you can focus on looking at mammography, the benefits versus the risks. And Catherine and I both have trained with Laszlo Tabar, who's an amazing breast imager, and he's done probably more research and data on looking at prevention of breast cancer with screening mammography. They did these huge trials in Europe, and it clearly shows that screening, particularly in the group 40 to 50, women that are going to be taken out of that screening group, if we switch to the USPSTF guidelines, we're going to miss the opportunity to diagnose cancers in those women. And it's very frustrating for us, because when you do this every day, if someone flips a switch and all of a sudden says, oh, stop screening and stop looking, I think of all those women under the age of 50 in our practice who were found to have early curable, treatable cancers by mammography that aren't going to be screened.
Well, and it's just money saving. Is it money saving or is it ignorance? I guess it's both.
I don't think it's really money saving, because if you think about it, if we diagnose women with early breast cancer, maybe they don't have to have chemo. Maybe we can do things to prevent future cancers in them. If you then take all those women, they're still going to get breast cancer. So if we don't diagnose their breast cancer at 45 and we diagnose it at 50, they're still going to get breast cancer. But now they're going to need chemo. Maybe the cancer will have spread elsewhere and they're going to need multiple years and years and years of treatment. That doesn't save us any money. It really doesn't.
That's
a mammogram versus years of chemo, there's no comparison there.
And if the people that are kind of running Washington don't really know what's coming in the Affordable Care Act, how can we know? We don't know if and when certain treatments are going to be allowed or not allowed. We don't know whether we're going to be able to continue to treat our patients with, like I said, I spent the weekend with women with stage 4 breast cancer. Are they going to be allowed in the future to continue with treatment that's experimental or that's quite expensive? And nobody knows the answers to those questions, and that's where we as physicians, we would love to know what's going to happen in the next 5 to 10 years in healthcare, because if healthcare is taken out of the arena of being decided by and determined by the physicians, and now it's going to be legislated or determined by government, it then becomes a question of, okay, well, who's in charge here? And, am I moving to Costa Rica and, practicing medicine, going back to primary care, because I'll be so frustrated with the system that I can't change.
Well, it's just one more reason people have to be aware and stay on top of it. And so I think that's the bottom line for people. And for you, what I love is your whole view of breast health and body health. In other words, that you're saying eat whole foods, don't smoke, don't drink too much. I love that holistic view that you have, and we don't hear that from the government either.
No,
we don't hear that as much.
They don't. Now obesity is a disease. It's not something that we're trying to tackle from a. There's no differentiation between healthcare plans on how you take care of yourself. I mean, if we were stratified in our insurance plan based upon how well you care for yourself, in my family, where we exercise and eat a healthy diet and work on de-stressing, I pay the same premiums as someone else who doesn't exercise and eats bad foods and doesn't take care of the temple. I mean, I look at my body as the temple my soul chose. So got to take care of the temple, because if this soul is choosing to be in there, the temple's got to be a pretty good place to live. And we try to do that with our patients by letting them know that, all the mammograms in the world, aren't going to change the fact that your body is what your body is. And only you can make those determinations and those choices to change what's happening in the temple.
We're going to talk more about the temple when we come right back.